Hello, hi. I hope your people are able to see me, hear me. So, good evening, good evening. So, another week. Okay, so we are going to discuss about one condition which the whole world is facing, and it's a big problem right now. And many people say that India is the diabetes capital of the world. Okay, so let us discuss a little bit about diabetes today. So, that's the topic. Okay, so this is the Ask Me Anything, the weekly sessions which we have every Tuesday, 9 p.m. IST. So today we are going to discuss, I'm going to just go through diabetes and the Ayurvedic perspective. Okay, how Ayurveda looks at diabetes. In Ayurveda, diabetes is called prameha. Okay, so prameha is the word for diabetes, and let us just go through how Ayurveda discusses. Okay, so diabetes and Ayurveda. Diabetes is prameha. Okay, so prameha is the word for diabetes, and it is two words, pra and miha. Okay, pra means excess, and miha is from the word mihsechane, that means watering. That is excessive urination, both what quantity and quality is basically the major symptom of prameha. Okay, that's the reason why diabetes has got the name prameha, because prameha means excessive urination. Okay, so that is the major symptom which we notice. Okay, so it's when you look at the disease as such, prameha, or the classification. How do one get prameha? Okay, the one thing is sahaja. Sahaja is hereditary. That means my grandfather had, my father had, I have got, my uncle has got. So it comes through a family. And the other one is doshaja. Doshaja is dosha visheshan. That means all the wrong foods which you consume, or all kind of wrong activities you do, that also leads to prameha or diabetes. Okay, and clinically we have classified, Ayurveda classifies that into two, that is sthula prameha rogi. So when it comes to the diseased person, rogi means a person who is diseased. Sthula prameha rogi and krishap prameha rogi, that means a person who is obese and a person who is thin. So these are two ways in which diabetes has been classified, for a person who is on the heavier side and a person who is thin. Okay, so what are the causative factors? According to Ayurveda, the causative factors you can note, these are the same causative factors which modern science also says. Overeating, okay, excessive sleep, curd is something which Ayurveda says, which modern people don't say. Excessive curd is, all these are excessive. Okay, excessive curd. And domesticated meat, in the sense it is not meat which you get not like if you say about chicken, you have got this broiler chicken which is grown, or you have got the country chicken. Country chicken is much better. Milk and milk products, if you consume in excess. Fresh grains, especially rice. Okay, we say that rice has to be consumed only 1 year after it is harvested. So if you leave it for a year, it becomes lighter. But if you have got the habit of consuming fresh grains continuously for a longer period of time, you have got a chance of getting diabetes. Okay, jaggery in excess. So jaggery also is something which kept for a longer period of time becomes much better rather than fresh jaggery. Lack of exercise. All of us know that if you don't have any exercise, the kapha of the body goes up, and that can directly, over a period of time, lead to diabetes. Excess liquid diet. This is something which Ayurveda says. We see a lot of people drinking a lot of water nowadays. Okay, they are overhydrated. So if you look at people who drink a lot of water, what happens is they pass a lot of urine. People who drink more water pass a lot of urine. And the premonitory symptom of prameha itself says passing excessive urine. So, what the Acharya says is, if you keep on drinking a lot of water, then you are actually starting off or triggering of the premonitory symptom of prameha, that is passing too much of urine. So, don't consume too much of water, everything in moderation. So, every activity of food which can increase your bulk or the kapha can also lead to prameha. Okay. So, next. So, what are the main symptoms? Okay, Prabhuda Mutratva. Prabhuda Mutratva means excessive urination. And Avila Mutratva. Avila Mutratva is turbid urine. So, if you pass urine in excess, and if you pass urine which is turbid, that means which is not very clear. Okay, that are the main symptoms of prameha which has been mentioned in Ayurveda. Okay, so when you look at the modern science, three things they say: excessive thirst, excessive hunger, and excessive. Okay, thirst, hunger, and hunger and appetite. That's a typing mistake. Is excessive thirst, excessive hunger, and excessive urination. Okay, so just because when there is excess of sugar in the blood, okay, the body wants to eliminate it. So the only way it can eliminate it is through the urine. That's one reason why you pass a lot of urine. And the moment you pass a lot of urine, what happens? Your body gets slightly dehydrated, and that's why you want to drink a lot of water. Okay, and then because the sugar is still in the blood and it fails to get into the muscles. Okay, what happens? You feel like eating more, so that you give a lot of glucose supply to the body. So that's the reason. So you urinate more, you feel extremely hungry, and you feel extremely thirsty because of diabetes. Okay, so classification. Ayurveda has classified diabetes into basically three. Okay, we have got Vata Pitta Kapha. Okay, so there are 20 different kinds of diabetes, okay, according to Ayurveda. And the 10, Kaphaja we have got 10, Pittaja we have got 6, and Vataja we have got 4. Like any disease which we have got in Ayurveda, it starts from the Kapha stage and then goes into the Vata stage. So the Kapha stage, okay, is something which is curable. Okay, these are also stages. So the Kapha stage is something which is curable. The Pitta stage is something which is manageable. And once you reach the Vata stage, we normally consider it as incurable. Okay, so this is how we have basically tried to manage prameha. So in prameha, in the first stages, when the person has got the strength and all those things, we do we do shodhana karma. Okay, we do the cleansing process. And when the person gets into the Vata stage, he doesn't have so much of disease, so much of strength, and the disease is also progressed. So we don't do the cleansing process. We try to manage it with medicines. And anyway, lifestyle is something which has to be taken care of as far as diabetes goes. So diabetes is, you see a lot of diabetic cases nowadays. Even in my clinic, I see so many diabetic. I think for the past 10-15 years, Okay, I've started seeing off late. I've started seeing diabetes even in young adults. At the age of 35, 40, they start getting diabetes, and it slowly, they don't do too much, they don't put that kind of effort to actually do a lot of changes in their lifestyle, and we see that it actually progresses according to Ayurveda from the kapha stage. It progresses into the vata stage, and then it becomes incurable. Okay, so this is how basically Ayurveda looks at prameha. And prameha is not a very new disease. If you look at Charaka Samhita, which was written close to about 3,000, 4,000 years back, even in Charaka Samhita, you will see prameha roga. Okay, and complications of prameha also has been told. Modern people say about diabetic carbuncles. Ayurveda says about prameha pitaka. You got boils and things which take a longer period to heal because due to the presence of glucose in the blood. Okay, so if you have got any questions, you can ask me. Okay, we can slowly start with the questions here. Any questions? Any questions? Okay, as I said, if a person is obese, okay, you can basically give him shodhana or the cleansing process. But if a person is lean, you can't do the cleansing process. You can only do the nourishment for him. Okay. So anybody's got any questions? Okay, Hirapat. Dark patches around neck, knees, and mouth appear due to diabetes or pre-diabetes. How to get rid of this pigmentation? Yes, pre-diabetic, you will actually, pre-diabetic people start seeing a little bit of symptoms. One symptom which is sometimes very obvious, as you said, as the dark patches, but also, when a person speaks, you will see saliva, and when he talks, this is a very, 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 you have to watch very closely. When he talks, when the lips part, you can see the saliva sticking. It'll be, you can see a saliva from the upper lip to lower lip. You can a thread of saliva. So that is one peculiar premonitory symptom of diabetes. Okay, so when you are pre-diabetic, the sense that is the stage where you have to do a lot of work. I'm telling you, Hiraban. You have to focus on your exercise. You have to focus on the kind of food you're eating. Medicines, no, I don't say. Pre-diabetic is a very, very confusing thing. Sometimes you get really confused with the values which you see in your blood report. Okay, the body might be trying to manage your sugar level. Okay, and suddenly you see your blood report, you see your fasting might be close to 100 or 100, 110, and you say you're pre-diabetic, but in 3 months suddenly you see you are somewhere around 140, 150. Okay, it is because your sugar is being managed by the body, and suddenly it lifts it and say, oh, I can't handle it anymore, and you see that sugar is really high. So if you're pre-diabetic, in my opinion, if you're pre-diabetic, you are diabetic. You have to take care of your diabetes. Okay, and the moment your sugar level comes down, all these patches will go down. You start, probably you would have started putting on weight also. These patches will clear completely. Nothing to worry, Hira. Okay. Okay, Mallikarjuna. Please suggest a good Bala Thailam to senior citizens and for adults. Bala Thailam, okay. I think you would have intended that oil which can promote strength, right, Mallikarjuna, if I'm right. If that's what, or is it Bala Thailam? Bala Thailam is also a product. Bala is Kurundoti in Malayalam, okay. So Dhanvantaram Thailam is one Thailam which can be used across all age groups. Okay, senior citizen and adults. Kids, we have got some other oils, but for senior citizen and adults, Dhanvantaram Thailam is the general oil which you can use for all conditions. Okay, but if you are looking for an oil which can promote strength, then there is one oil called Bala Ashwagandhani Thailam which can be used. Okay, but it is always good to actually what you call consult a physician, try to find out which oil actually suits you, Mallikarjuna. Okay. Lakshmi, what are the general symptoms? The first symptom, what you see is you might start passing urine in excess. Okay, and your throat slowly starts getting dry. You like feel like, because you're passing a lot of urine, your throat goes dry and you'll feel like drinking water. These are the major two symptoms which you start seeing when you slowly start becoming diabetic. Okay, and people say about fatigue and all comes later, and excess of hunger also slow. These are all steps. Okay, the first two major thing is excessive urine and thirst. What follows next is hunger. Okay, and then fatigue and all those things follow. These two symptoms are the first things which you see. Okay, so Ramesh, what are the lifestyle changes we have to adopt to avoid? See, diabetes, if as I said before, diabetes is something you get is sometimes hereditary, and sometimes it is because of the bad lifestyle and food you take. So the second condition, if it is because of the bad lifestyle you follow, okay, Ayurveda says nidana parivarjanam chikitsa. That means avoidance of the causative factors treatment. That's it. If you know these are the things which are causing your problem, okay, avoiding that is the first line of treatment. If you say, no, I cannot avoid that, but give me some medicines, then what happens is, with the medicines, your values are kept under control. But because you're not changing the causative factors, your disease will slowly start progressing from the side. So that is not a good thing. So being, as I said, I gave a list of all the causative factors, like, sedentary life, eating things which increase the kapha, okay, and overeating of sweets, anything that can promote your bulk. Okay, drinking too much of liquid also is really bad, and even water for that matter. If you overdo it, all these things are promote all causative factors for diabetes. If you can avoid all those things and try getting into physical activity and eat food on time and low in moderate quantities, it will actually do well for you, Ramesh. Okay, following up on the pre-diabetic question, what if one was already a little overweight since childhood, big frame person? So a person slightly overweight is a person who is kapha prakriti. Okay, that is his nature. If he indulges in all the causative factors, as I just explained before, like extremely sedentary life, day sleeping, okay, indulging in too much of milk and milk products and sweets, and absolutely no excess and all, he has got a higher chance of being diabetic than a person who is slightly on the leaner side. Okay, so the causative factor is same, but a person, you have got a predisposing, like if you have got a parents who are diabetic and grandparents and all that, if you've got diabetes running in your family, then you've got a predisposing factor. Likewise, a kapha person, for him to become diabetes in the first place is much easier because he's already got that kapha there. So it's always good for you to actually start doing a lot of exercises. You don't have to start losing your weight because that is your nature. But being active and controlling all the foods which can contribute to diabetes is very important here. See, I still don't understand, Mallikarjun, what do you mean by Balatailam? Balatailam is a preparation which is made of the drug, which is made of the herb Bala. Okay, if you're asking for strength promoting, I would say yes. I still say Dhanvantari Tailam is very good for around the knee joints. Okay, and Mahanarana Tailam is also good if you have got pain. There are different kinds of oils. It depends upon your condition. That's why I said it's always good for you to consult somebody and see what the condition is, and then, because there are so many oils. It is in separate conditions. Bala Shogandhari Tailam, I say, is supposed to be one of the most strength promoting oils. If sleeping in the day increases kapha and keeping awake in the night increases vata, aren't they supposed to balance each other out, owing that kapha is opposite to vata? See, that is actually a very good question, But if you look at the way nature is, okay, day sleep is something it is not contraindicated all throughout the year. Okay, where if it is summer, you can take a nap in the afternoon. Or if you are old or children, or if you have disease conditions, yes, you can take a small nap in the daytime. Or if you're somebody who's doing excessive physical labor, yes, you can take bath you can take a nap in the afternoon. And now coming to actually staying awake at night. Okay, staying awake at night increases vata. Yes, you are right, but the problem is that that also increases pitta, and your metabolism is also gone for a toss, and that is one reason you'll end up having other problems also. Okay, so day sleep, we say day sleep increases kapha, but if you don't sleep in the night, it not only increases vata, it also increases pitta. So that is not good for you. Okay, that's the reason why we say day sleep. Not about if you catch up a nap of about 10 or 15 minutes, that might not be a problem. But there are people who sleep for an hour and a half. They will go. For them, it's a predisposing factor. HbA1c factor is actually a very good test to find out how you are faring with diabetic control. Okay, HB means hemoglobin. Okay, and the sugar value is basically taken from the hemoglobin, and you know that red blood cells have got close to about 3 months. They have got a life of about three months. Okay, so when you take the HbA1c value, it also shows what sugar you had. No, it's mean average. Okay, so for example, if you're going for a fasting blood sugar tomorrow, if I don't take anything fattening, no sugar tonight or today afternoon, and then I go for a test tomorrow morning, I can actually fool myself. The values will show very low, and then I'm very careful. I eat only chapati and then go and take my fast after food. The values will be slightly low, but you cannot do that with HbA1c because it's a mean average for 3 months. Okay, the jalebi or the laddu or the sweet or the pastry which you ate last month will also come in HbA1c. So HbA1c is something which is more accurate to follow rather than the fasting. Yes, we need fasting and postprandial also, but HbA1c, you can make out how good control the person has got. An Ayurvedic doctor or practice suggests that consuming Shatavari and Shogandha and applying Yuvatyadi Tailam can increase breast size. Is this true? If not, what are the solutions? See, Hira, breast size is sometimes, you know, it is hereditary. Okay, and it is by birth. The tendency to have big breasts also is hereditary, and there are other factors also. If a person is slightly on the plumper side, there is always a chance because due to excessive fat, there is a chance that the breast can be slightly bigger. But increasing the breast size, yes, you can actually firm it by doing certain exercises which will actually help you lift the what you call the breast width by doing exercises for the pectoralis muscles. But it is not very easy to actually increase the size of the breast by applying oil or taking any medications inside. But if you have got an hormonal imbalance, and if the hormonal imbalance is basically corrected, yes, naturally the breast size will slightly grow, but you can't make a tremendous change in the size with any medicine. Yeah, I just explained that, Hira. I don't think. See, it is very difficult to increase the size of one part of the body with food. Okay, when growth happens in total. Okay, and you would have noticed women who have had decently big breasts, as they age and they become frail, they become thin, they become bony and skinny, you'll see that they'll lose their breast more than 80%. Okay, because breast is almost fat. Okay, so if you want to increase the breast, if you consume food which are fattening, you will, unfortunately, you'll also put on fat on other parts of the body also. So I don't think that is actually a very good choice. I understand that women sometimes feel insecure when they have got small breasts, but food and other things, you can correct. If you've got a hormonal imbalance, correcting the hormonal imbalance should be the right way. There are kashayams and medicines for that, which will actually correct the hormone imbalance, but that will not, to a large extent, that will not increase the size of the breast. Are diabetic patients prone to fungal infections? Can you suggest any remedies for fungal infection? Diabetic patients, by and large, are prone to all kinds of infections. Okay, and once a diabetic patient gets infected, it is not easy for him to come out of the infection until and unless the blood sugar is kept under control, because the blood is full of sugar. Okay, and any infection, any bacteria or virus or some whatever it is, any organism which enters the body, it is a feast for them because of the sugar in the blood and in the tissue. So it is very important to see that the blood sugar is completely brought under control. That's the reason why if you're diabetic, they will not operate on you, because healing becomes slow because of diabetes. Okay, so fungal infection, yes, you have, the primary thing is to get the sugar under control. And any fungicide, you can use. There are a lot of, so Jeevantyadi Yamakam is one of the best medicines which you can use as an antifungal. But those things will work on a diabetic patient only when the sugar is kept under control. Okay. So any other question? So see, that is a problem with diabetes, because the presence of glucose makes these any invaded organism, okay, microorganism, actually live and prosper pretty fast. They multiply so fast that to control the infection is very tough. So getting the sugar down and then handling the problems, what you have to do. Keeping the sugar high will not help you. Yeah, Anirudh and Rajshekar. Can reducing simple carb intake reduce blood sugar levels, as the new studies show that consuming salads followed by protein and fats before consuming simple carb like rice? Okay. See, these are small techniques where you are actually managing the glucose spike. Okay, so glucose spike, you can control this glucose spike, but reducing carb is something which we say yes, because carbohydrates directly add to the glucose in the blood. But that is not what the problem here is. The problem is that the body is not able to manage the glucose which is there in the blood. Okay, so when you consume food in this order, yes, you will be able to manage the sugar spike in the blood, but the issue is still not managed, Anirudhan. Hope you're able to understand that. Will stress increase sugar levels? Yes, stress can increase anything. Okay, most of the autoimmune conditions are directly related to stress. Okay, what happens in stress is your immunity is compromised, and that leads to issues. And in this case, when you are stressful, your metabolism goes for a toss, and diabetes is definitely a metabolic disorder. So metabolism goes for a toss when you are stressed. Some people don't eat, some people overeat, some people, they are so sedentary, they don't even want to move when they are stressed. So everything adds to diabetes. Is one other complication which you can get because of stress. Stress is directly related. You will, no, I don't want to say you will, you have got a very high probability of becoming diabetes if your stress is not under control. Yeah, and that's what I said. It can keep your sugar levels from spiking, but that is not a treatment. You have to still take care of your disease progressing by making necessary lifestyle changes and food changes, because see, if you look at, by and large, South Indians are used to eating rice and food in a certain way. Okay, that is not the reason why they became diabetic. Okay, there are other reasons why they became diabetic. So by adjusting the food, you can actually control the sugar spike. But try to find out what was the reason for your diabetes. It could be stress, or it could be some other thing which you have indulged. Might be alcohol or too much of junk food. Suddenly changing and making this thing is not a permanent solution. Is what I'm trying to tell you, Anirudhan. The root of sugarcane cures diabetes. Hira, I'm not very sure about that. That the root of sugarcane will cure diabetes, but in the first stage, when you have just become diabetes, okay, you don't even have to take any medicines. We don't generally tell them to take any medicines. We tell them a major lifestyle change for them to actually, getting physically active and see what goes inside your mouth and then your mind. You have to, you can't be so stressful or anxious for a longer period of time. Your it will just trip. Okay. I walk long distances followed by fasting post 6 or 6:30 in the evening. I understand that. So basically, I think it is like intermittent fasting. Okay, you don't have anything after 6:30, and then you have your food only in the morning, giving gap between meals. See, initially people used to say that you have to have small meals in regular intervals to manage diabetes. Yes, I don't say that is wrong, but if your diabetes is chronic, okay, okay, can you hear me now? Okay, so can you hear me now? Okay, thank you. So, let me explain that. Okay, so if you have been diabetic for quite some time, then it is always good for you to have food on regular intervals. But if you are pre-diabetic or you're just diabetic, it is always good for you to give that gap before your food is completely digested. So wait for the food to digest and then consume your next food. Okay, and intermittent fasting is something which it's a different topic altogether. Intermittent fasting is good, provided there are some conditions. You have your food at 6:30, and if you're sleeping at 12 o'clock, I don't, or 11 o'clock, 12 o'clock, I don't think that kind of intermittent fasting is good. Okay, I think, Amruthan, you understood that. That good. You have your dinner at 6:30, but I would say if you have at 6:30, your food gets digested by about 8:39. Okay, and if you don't sleep, your metabolism again restarts, and you feel like eating something at night. You might resist yourself, but you feel like eating something because, as I said, when you stay awake, your vata and your metabolism kicks in. You feel like eating something. That is also not good. Okay, so intermittent fasting, part of it is good. If you sleep early, it's perfect. Okay, you have at about 6:30 and go to bed about 9:30, and you sleep all the way till about, might be about 6 or so. Sleep without any guilt, get up in the morning, and then have your meal at about 8 o'clock. You have got enough time for the body to reset a lot of things. That's actually good for you. But stress is something which you have to manage. Yeah, Andruthan, I envy you that you sleep by 9. And thanks that you're awake tonight to listen to me. Okay, any other question? Great. Okay, so people who, if you have got people who are diabetic at home, okay, don't panic too much. Okay, but you should basically support them and see that. See, it's basically trying to find out the causative factor. You know what actually caused diabetes. If it's hereditary, we don't have too much of a choice. Okay, but if it is, if a person is getting diabetic, say post 40, 45, 50, and they say, my father also had diabetes, my grandfather also had diabetes, I don't want to buy that too much. It is because he also went through all those causative factors for him to become diabetic. If it is hereditary, he would have got it at least by about 30, 35 before 40. After 40, 45, 50, it's all mostly because of his lifestyle. So understand what is going wrong and then, reverse it. That's what we basically call about diabetic reversal. Okay. And complications of diabetes, it can affect any organ. It can be your eyes, it can be your ears, it can be your feet, it can be a shoulder, frozen complications. Anything, any organ can get affected by uncontrolled diabetes. So that is something which you have to take care. Okay. So I think that's all for today. Oh, okay, Hira, but sorry, I missed one question. If one has suffering been insomnia for a few years, first of all, try to understand why. As I said, getting the causative factor is very important. Why are they not sleeping? Okay, it could be basically there might be some trauma which they have gone through that they are not able to sleep. Okay, taking a sleeping pill, yes, will physically put you to sleep, but it is not the right kind of sleep. So what do? Try to find out what went wrong. I would say it's always, rather than going directly to a physician and taking a sleeping pill, it is always good to try to go to a psychologist and try to find out. A sleep expert is there, would be able to sit with you and try to find out what went wrong so that your sleep is disturbed. That is very important. Medicines and all follow after that, Hira. Okay, because long term not sleeping will actually start affecting the body also. So the training is, this is what I say, you have to go and get that bug out of your system, that which is not letting you sleep. That's very important. Trying to, as I said, find the causative factor. Okay, somewhere, some trauma somewhere, might be childhood or might be adulthood or relationship issues, something, or financial issues, something might be there which is not letting the person sleep. That has to be addressed. Without resolving that, medicines and other things will not have. Those are all temporary things. Then you'll become addicted to medicines. Then you will not sleep without medicine. Okay, then after a point of that medicine will not have effect on you. You have to keep on increasing the dose. It's a vicious cycle. It doesn't work like that. Okay. So I think that's all for today. We'll meet next week with another topic. Oh, does exercise, one last question from Anirudh. Okay. Does exercise like heavy weight lifting and walking reduce sugar in the blood? Yes. Okay. But I would say, just to reduce blood sugar, don't go for excessive heavy weightlifting where your body will not be able to handle it. Okay, walking is fair enough, and I would say weightlifting is good. Don't go for excessive, but use moderate weight, and if you want, you can use multiple reps. And if you start giving exercise to your muscles, the absorption of glucose from the bloodstream goes up multiple times. So a person who is walking, if just simple thing, people do these tests, they eat a meal and they sit idly and check their blood sugar. The same person eats a meal and goes for a half an hour walk and comes back, you see the blood level is lower. Exercise has got a direct relationship to blood sugar. So doing exercise is very good, Anirudh. Keep on doing it. Okay. So that's all for today. We'll meet next week. Okay. Any questions? Yes, you can ask. We'll meet next week. Okay. Good night.